Measles is making a comeback in America after being declared eliminated 25 years ago. And CDC data shows Idaho has the lowest youth vaccination rate in the nation.
Now, doctors say that's putting families at risk. Our Jude Binkley spoke with a local doctor about the troubling trends. Jude.
Hunter Morgan, the number of children vaccinated against measles has been dropping for the past several years. There's actually data right here. The states in black are under a 90% youth vaccination rate. Idaho right now is actually now under an 80% vaccination rate. And there are growing concerns over the state's vulnerability to potential outbreaks. Idaho has the nation's lowest measles vaccination rate for children, a dangerous trend that has local doctors worried.
We noticed a steep decline in the pandemic in 2020.
Dropping about 10%, leaving 1 in 5 kindergartners unvaccinated.
To down where we are right now, which is just under 80% of kindergartners have their MMR vaccine.
Ann Weiss is a doctor with primary health and says a vaccination rate of at least 92% is needed for herd immunity.
Since we're down under 80%, we don't have that. And so it's going to be difficult to manage an outbreak here with so few who are vaccinated.
A growing concern after 2 kids died following a measles outbreak in Texas, the first pediatric deaths from measles in 22 years. Measles hit home last month when an infected traveler brought the disease to Burley, showing how easily it spreads with fever symptoms and a rash.
The problem with measles is that you are contagious 4 days before the rash onset.
Health officials say the trend has been driven by vaccine hesitancy since COVID and limited health care access in some rural areas.
Most of the counties here in Idaho are rural, and so that means they have less access to medical providers and maybe just don't make the effort because of the roadblocks.
Children are commonly given the measles, mumps, rubella vaccine in 2 doses between 12 and 15 months and 4 to 6 years old. You can be vaccinated later. Parents who are interested can contact their pediatrician to talk about the MMR vaccine.
For adults 19 and older, we do offer MMR vaccination at several of our clinics.
Health officials say vaccination is the best way to protect yourself from the potentially deadly disease.
Consequences of measles are potentially very life-threatening. Most people who contract it will probably be fine, but we know that there is a group of people, about 1 to 3 in 1,000, that will die from measles.
And Dr. Weiss says it's not just the healthcare community who's concerned. They're seeing Idahoans worried about this as well. Actually, several people have come in to get tested. And again, there have not been any confirmed cases here in the Treasure Valley.
Okay, Jude, thank you.